Thank you for taking the time to join us for an update on where things are at with all things COVID-19 and the workplace. These past few months have been a challenge to navigate through, and we are happy to have really been able to work with the community leaders we have, including the staff at Elevate and Larimer and Weld County workforce focused areas. Today, we are working to bring you an update on all of the things we think you need to know now as we continue to navigate these uncharted and unfamiliar times together. I'm Amanda Erickson, and I am joined by Jeannie Valier, and we own HRX Services. Jeannie, you want to take a moment and say hello?
Hello, how is everybody today?
Thank you, Jeannie. HRX Services is a boutique partner-focused HR consulting firm working with HR teams of varying sizes on all things compliance and HR best practice related items. Between the two of us, we hold credentials in PHR, SPHR, SHRM CP, SHRM SCP certifications, as well as we head up and serve as HR experts on various boards and organizations, including the COSHRM, or Colorado Society of Human Resource Management State Council, the local NCHRA, Northern Colorado Human Resources Association, SHRM chapter, and the Weld County Workforce Development Board. We enjoy partnering with Elevate and Mike Kohler on all things HR related and appreciate the opportunity to speak with our local business leaders and HR pros. Thanks, Mike, for having us. Would you like to take a moment and also say hello?
I would like to take a moment. In fact, at the risk of hijacking your webinar, I'm on to those of you who, credentialed or not, are in the HR category, because I know darn well that one of the things that you're not really strong at is bragging yourselves up. And in the case of HRX Services, I'm going to do a little bragging for them. In July, they are going to be offering, because they won't tell you about this, but I will. They're going to be offering a 4-part series for companies that want to create or improve a robust foundational HR program. You are well advised to be on the lookout for that series by these two professionals, and you'll be glad you did. So that's coming in July, starting July 8th, 4 consecutive Wednesdays. Enough for the infomercial. Oh, I'm Mike Kohler, the Elevate Training Coordinator, by the way.
Thank you, Mike. We are so pleased to be doing this with you, and thanks for having us again. We do appreciate it. So as we are about to jump forward and begin the session, a couple of housekeeping items to get out of the way first. First, this session is being recorded. So I would like to remind you that if you do not want to participate in a recorded session, now is the time to exit this webinar. But since we are recording this session, the date for today is May 27th. Have that right, Jeannie? Just in case you happen to be viewing this session at a later date and things may have changed. Additionally, while Jeannie and I hold certifications in these designated credit areas, everything we are presenting here today should be viewed as best practice ideas only. Nothing we are presenting should be received or construed as legal or tax advice, and anyone seeking specific information about their individual organization's needs are always encouraged by us to engage with the partners in those areas directly for guidance. However, any general questions, we would be happy to share our thoughts and provide clarification around today. Now, in order to connect with us here and ask those questions, we are using the Zoom webinar format session tool for today. This means you should find a raise hand function in your toolbar. Your toolbox may have hidden below your screen, and you'll want to hover toward the bottom of the screen in order to find it. So let's see if everyone is tracking here, and please hit the raise hand icon now. Outstanding. You are rock stars. There's also a chat box feature in your toolbox. This will be using for any systems related issues you have if you can't access something. If you have specific questions, please use the questions and answers tool in your toolbox, as we can better answer those questions there. Jeannie will be monitoring those areas, so please feel free to engage with us throughout our session today. Now, due to popularity of the session, we have not enabled your microphone, so the Q&A box will be the best place to interact with us for this session. Now, without further delay, let's begin. Our agenda today is focused on the outline in your screen right now. We plan to work through FFCRA and bring a little familiarity back to this item, as it will be more likely impact employers going forward than it may have in the past. And we'll talk a little bit about why that is. We'll also dive into the employer and workplace-focused aspects of the CARES Act and see about the areas that may be impacting us in that area at this time. We'll talk through the concerns we think you should be thinking about for the state of Colorado, both as a COVID-19 impact and the legislation that we think you should be preparing for now. We'll talk a little bit about how it all works together, and then most importantly, some of the areas we feel employers should be paying special attention to while navigating this pandemic. So we got a full slate. Let's get started. As we're working through changing dynamics in our workforces, let's review some of the legislation we already have in place over the last few months. So starting with FFCRA, or the Families First Coronavirus Response Act. So while unemployment, healthcare, and tax credits were all included in the FFCRA, we think much of what employers will be working through is really focused on the paid sick leave and expanded FMLA components of this law. So we see those as really impacting workplaces at this time and what we're going to focus our discussion on today. So first and foremost, kind of walking through it, just as some familiarity and reminders. The first piece of the paid sick leave of FFCRA is really to provide sick leave when it's required. The goal obviously is to try to encourage employees to stay home if they are sick and not well, so that they don't have to come to work. Now, you do have the opportunity for up to 80 hours of paid sick leave, and this is an employer paid benefit to employees. Now, this applies to employers with 500 employees or less. And if you've had that situation where you might have had to furlough people or lay some people off, then really your changing dynamics could affect whether or not this law would affect you. The eligibility for an employee to be able to take advantage of the paid sick leave begins on their first day of hire. So there's no waiting period for the employees. And while at the beginning of this, when we first did this webinar and we were talking about FFCRA, the impact was really focused on that April 1st date. I'd say now we're really talking about that December 31st date. So this still continues, even though maybe we've kind of shifted into different dynamics in our workforce, that date will have some significance for how we're working through it now in the workplace. So first, we want to talk about how the paid sick leave then works. So it's going to be used either for the employee themselves and for their own health-related condition, or for them to care for another person in the home. So either this person would be looking at needing assistance because they have COVID-19 related concerns, or this could be a childcare related need. So we will be providing these slides just as a note, so you can easily reference this information after the session so that you can kind of walk through how this timeline works together. Again, we're really just sharing it just to make sure that we're remembering how all of these things come together. So what employers should note now? Well, first, I would say school is out, right? We don't have school in session anymore. But daycare can be a real challenge right now. So if your daycare is closed, some are open. However, there's still a comfort level with wanting to put your kids into daycare. And then of course, waiting lists and max capacity requirements are always in existence for daycares, and especially the daycares that are open right now. So additionally, we may also see people needing to use the paid sick leave as they're returning to work. Jeannie, I'm going to ask you, why do you think this is? Like, why are we going to see more use of this than maybe we have at the beginning of April?
Well, I think probably the most common reason is at the beginning of April, folks were being laid off, and now we're bringing them back to work. And most of the employers that we work with, they had an opportunity to apply for the PPP loan. Yep. So that being said, now most employers are covering their payroll. They have workers coming back at least through June 30th. So what happens after June 30th? Now you have more folks coming back to work, which means the potential people are getting sick again. And now you're bringing it back to the workplace. So now you're getting paid sick leave. I think there's a lot of things that we need to put in practice as people come back. So for example, OSHA has very specific guidelines regarding a pandemic and how to respond to it as an employer. The CDC has put an enormous amount of communication out, everything from posters to how to disinfect your workplace, how to take temperature checks of employees, how to handle it if an employee gets sick. So I think looking at all of those things, now we increase our risk as an employer. We're going to see, I think employers are going to potentially see future issues in terms of potentially being sued. Why? Because did the employee say, I don't want to come back to work. I'm afraid to come back to work. And now you're getting into ADA concerns, the American Disabilities Act, and looking at accommodations. So I think there's going to be a lot of new challenges. And I think it's all going to start with the practices you put the day that they return to work. What does that mean? Policies on them returning. How do they return to work? Social distancing. How are you going to handle your 50% capacity? Your telework, your structure, training. I think it all begins with training. How do you train your employees for this quote unquote new normal? And of course, now we have to provide PPE equipment to our employees if they didn't previously have it.
Yeah. And I think that, and we're going to touch on all of those things, I think in detail as well. And to your point, one of the biggest reasons that some of these things are going to be applicable or things that we need to be more concerned with is because before we might have been laying them off and furloughing them and reducing their hours. And for consideration when it comes to FFCRA paid sick leave requirements, you had to be working normal and regular hours. Now that we are going to be working regular and normal hours, you may see more of this impact in those areas. But let's move forward and talk a little bit about what you're speaking of when we're talking about some of these regulations as well. So additionally, with the FFCRA, we've expanded FMLA. So this applies again for the child care school/related need for leave. This expands regular FMLA and certainly has different pieces to it. So how this is confusing is that employers who may not have to host FMLA requirements or have never really had to deal with that in the past are now required to comply with these requirements. So having to navigate and track all of this leave is really important, can be challenging. So FMLA still exists for employers with 50 employees or more within 75 miles of locations of each other. But there are some things then to note, because now we're looking at an employer who has 500 employees or less. So you might be a small employer under 50 employees and never had to deal with this. So some of the application of it, when it would occur, how it would work, again, you're going to see these slides, so you'll be able to walk through this. And I don't think that this is totally new to people. So it's just for some familiarity. But things to note. FMLA does run concurrently with the expanded FMLA. So you're not looking at, 24 weeks potential out there. We're really looking at only 12 weeks if both situations should apply. And additionally, employees can and are encouraged, if possible, to take leave intermittently. And all of the FAQ documentation and guidance that's out there, it's really encouraging that you might try to put in some type of form of you work one day off and one day on, and then maybe you can share with your spouse or a partner in the home who might be able to take the other day on, the other day off. So there's some ways to use this in an intermittent way. So Jeannie, what should employers be thinking about when they're thinking about that? How do you track this, or what are the things that they should be considering when they're thinking about that piece?
That's a great question, especially for the employers who have never had to track it. They're probably going to be struggling. There's some great tools out there. There's FMLA leave tracking systems that just do nothing but work on management of leave. Obviously, Excel spreadsheets. I think there's a fair amount of tools even located throughout the DOL that provide you different templates and things like that. But regardless, you have to track it. You have to, along with any documentation that you secure from the employee regarding their request for either the paid sick leave or the intermittent FMLA or just the FMLA or the paid FMLA. There is a required information that you have to obtain from the employee. It's very basic. It's not as cumbersome as the regular FMLA, but there is documentation. I think additionally, as you're thinking about how do you track it, but other things that you may have previously managed with FMLA, like your leave policies, vacation time. You know, we've heard from several clients, well, nobody's been able to take vacation because they've either been furloughed or they've had reduced hours and we kind of froze their vacation. You may want to think about looking at your vacation policies. Do you want to amend them? Look at potentially a carryover if you didn't previously have it, or maybe a payout if that wasn't something you previously offered. But I think that's something that people need to think about in consideration if they fall on a calendar year for their vacation accruals or vacation leave policies.
I think you're right. And I think that one thing that we do know with this particular guidance is that it's really up to the employee. So you can't force them to necessarily take this. That is something that's available to them. So this could work with having that, or the paid sick leave, having the paid sick leave and be able to still take your own sick leave that the employer is offering already. And then you might have then some stacking happening, right? So we've got our 80 hours up front with the paid sick leave. We've got some FMLA here on this end. We've got some paid expanded FMLA on this other end. So there's a lot of different components that really need to be tracked, and that can be really confusing. And I think that one of the things you and I have talked about is that when you start working in the intermittent piece of that, that's one of the more challenging components to track, even with regular FMLA. So if you're trying to provide an environment where you can have that intermittent, you know, give and take, really making sure you're having that conversation as the employee with your employer and as the employer with your employee, because there really does have to be a discussion as to whether or not that's something you're going to offer. So this, while it might be laid out and it makes sense in practice, there are a lot of moving parts, and really trying to make sure that you're tracking that for compliance purposes and that you're requiring and taking in the right documentation is going to be really, really important. Anything to add to that, Jeannie?
You know, I was just thinking, I think the biggest challenge is going to be exempt employees.
Okay.
Because exempt employees, if you weren't normally an FMLA employer, so let's say you were a small business under 50, now you all of a sudden have to track FMLA, whether it be just regular FMLA or paid FMLA or the intermittent. How do you track an exempt employee? Because typically that's not something that you would ever be worried about other than a whole day's absence. Yeah. So how do you handle that intermittent FMLA? You know, what systems do you have in place? You know, we use, for HRX, we use a system called Toggle. That's free. That might be something for folks to use to track FMLA, or at least track the time off for the FMLA.
Yes, exactly. It doesn't have to be hard, but it should be done. Let's put it that way, right? Doesn't have to be this big thing. We also know one of the partners that we've had on our sessions before, Tilt, also is producing. They have some leave management software as well, and a local company here in Fort Collins. So kind of shout out to them. But when it comes down to it, there are definitely tools and systems that you can use depending on the complexity of what you're trying to put together. Okay, so let's talk about some exemptions that may occur. So for small businesses, there is some exemptions that could potentially be qualifying, or you could be potentially qualifying for. Now, guidance is available under the Q&A online under the DOL, so just make sure that you're taking a look at that, because that's a really great resource. We have links for that on our website, and also, again, it will be provided at the end of this in our documentation that we'll share back with you after this session. So the first is, you know, in order to qualify, the small business exemption information would be, first, the expense of leave would have to be significantly debilitating to the small business. So this is something that would have to be obvious. There's also, the second would be, there are not enough qualified, willing, and able workers available, and the small business would need them to operate at even a minimal capacity. And the third reason for an exemption would be the absence of skilled and knowledgeable employees would be detrimental to the business. So these would be the exemption reasons for not having to comply with the FFCRA. Now, in order to qualify for that exemption, there's a few things that you need to be able to walk through. First, the employer needs to employ fewer than 50 employees, and the leave would need to be requested because the child's school or place of care is closed, or a child care provider is unavailable. One of the things to note is that a child care provider doesn't necessarily have to be like a daycare center or a licensed professional. Some of the things that we've learned is that it could be a family member who normally takes care of the kiddo, or it could be a neighbor. So just kind of keep that in mind, that when you're thinking about what that child care provider is and who they are. And then, and then also an authorized officer of the business, and that's still, could be president, could be an owner, could be somebody like that, has determined that at least one of those three conditions in the previous slide would satisfied. And so if you have these three things and then also that exemption, then you should be able to qualify for the exemption. However, they have said that they don't want you to send any materials to them. Don't send us stuff telling us that your exemption status and why and all of those things, but we would recommend certainly holding on to that information if you decide to use this as an exemption for your business. The other piece that we also know that occurs with FMLA, job restoration requirements are also a piece of that. However, there is also an exemption here, once again, for a small business to not have to restore an employee to their previous position when returning from leave. So your employer may refuse to return you to work if, as they're saying under the FAQs, in your same position if you are highly compensated or a key employee, and they use the FMLA definition for what a key employee is. You have fewer than 25 employees, so it's not the 50, it's only 25, and you took leave to care for your own son or daughter whose school or place of care was closed or whose child care provider was unavailable, and all four of these hardship conditions exist. So again, we'll provide these slides. So if you're looking at what is that job restoration, do I have to be able to put this person back in? What if I don't have that position anymore? Those are the things that you might be able to qualify for that exemption in this space. Okay, so why are these things important to employers, and why should they be thinking about this and understanding it? Well, mainly because obviously we want to keep our employees safe, and that's the most important thing, followed closely by not overwhelming our healthcare system and the workers that work there. But in addition, and Jeannie, you kind of talked a little bit about this earlier, we want to protect our company from litigation and mitigate risk as we're moving forward. So here is what is posted as guidance for people at this time on the FAQ. So if you believe that your employer, who you believe is covered as a covered employer and through this act, refuses to provide me expanded family and medical leave, the first thing that they suggest is to bring it to your employer and try to resolve having discussions and talk through it. The second thing that they say is you may also call the wage and hour division and report the issue directly if you feel like it's egregious enough. Or you can file a lawsuit against your employer directly without going to the wage and hour. So the way we look at this is we say really it is important to engage in the discussions around this, to really be careful if you're not going to offer or you're going to try to go for the exemptions here. And at the end of the day, our number one goal is really the safety of our employees. So that's what we're trying to figure out and move through at this point. And that's just kind of our brief overview of the FFCRA. It's a biggie, so hopefully that was helpful. So let's talk a little bit about CARES next. I'm just going to stop for a moment and see if there's anything that we need to discuss further, Jeannie.
No, nothing in the Q&A. I did want to add something regarding you. When you read off, it said if the employee believes you're a covered employer. Just as a reminder to everyone on this call, if they haven't done so already, if you are a covered employer, you were to notify your employees by posting the FFCRA poster. So that should clear up any concerns or questions as to whether or not you're the covered employer or if the employee thinks you are or not.
Very good point. Thank you, Jeannie. Okay, so let's talk a little bit about the CARES Act. Now, really the purpose here was to provide alternatives to closure and layoffs. Like that was the goal. That's what we're trying to do. The CARES Act gives employers the following options and benefits, which may allow them to stay open and keep more people employed. So principal focus areas related to HR include things like in the financial area, unemployment, healthcare, and then some of those individual benefits that we saw. Now, again, for workplace purposes, we're going to focus on really the unemployment impact here, as well as bringing employees back to the workplace as a requirement for some of the PPP or Paycheck Protection Program that, again, Jeannie had mentioned earlier, that loan that was very popular and a lot of businesses applied for. So let's work a little bit through what those specific areas are at this time. So safety is one of the first things that we want to work through in making sure as we come back to work as a team, we're addressing and being really vigilant and working through that. So first, the virus is thought to spread mainly from person to person, including through people in close proximity to one another and through droplets of an infected person. Now, it can be possible that a person can get COVID-19 by touching a surface or an object that has the disease. And as we know in the workplace, there's a lot of opportunity for this type of contact. So employers should be very vigilant at this time. Jeannie, what are some of the areas specific to safety that you think employers should be thinking about if they haven't already?
I think the first thing is to develop a policy as an organization. How, as you're bringing employees back, what are you going to do and how are you going to respond to this new way of working? So you need to let your employees, it's about being transparent, it's about being informed. So state from A to Z, everything from, this is our cleaning schedule. We are going to implement temperature checks. These are our hours of operation. If you're telecommuting now, can you continue to do that? I think as long as you kind of start there, that's the framework, and kind of just put it out to all your employees even before they return to work, so that you're getting, I know a lot of businesses are still kind of in that, do we bring them back? Do we not? So get that out to the employees. I think then once you've got that, make sure your workplace is prepared for these employees. Do you have the proper postings? Depending on what county you live in, there's actual required postings, how to wash your hands, social distancing. You have to be 6 feet apart.
And where they're posted, right? Like
agreed.
When you
they
come
have to
into
be,
the location,
yep.
multiple.
It has to be at points
entrances.
of entry.
Correct, yeah.
It has to be not only just for your employees, but if you're customer facing, it has to be so that your customers can see that information as well. Once you've got that out there, then start preparing the workplace. Clorox wipes, hand sanitizers, face masks. You may want to consider a porter service if you have restrooms that are high use or frequent use. You might even want to think about like a return to work coordinator, someone who is the champion of managing this process. If you're a larger company, it might be HR, it might be, your safety people,
person,
it might be
yep.
a risk. If you're a small business, it might be the owner, it might be the office, it might be the accountant. It just depends on what role you play in the organization. The next thing is, I think you need to think about what happens if somebody does get sick, or they call you and say, I'm sick. Encourage them to stay at home. I think that's a philosophy, a paradigm shift in how we think, because in the past, as an employer, well, if you're really sick or, you're almost encouraging them to come because you may not have your fully staffed or things like that. But that's changed. You want to do as much as possible to discourage them to stay at home. Face-to-face meetings. That's another one. You might want to cancel them or continue with Zoom. What about limiting travel? I mean, as we come back, are people going to start traveling again and doing, if you're a sales and marketing type organization? Kind of, again, thinking about the workplace, there's areas you may not even really think about: ice makers, door handles, coffee makers.
Yep.
The Xerox machine, or the copier, if people still have fax machines, keypads for a point of entry. I think once you kind of get through all of those things, the last thing you need to think about is that moment in time that an employee says, I have COVID, I tested positive, now what?
Yeah.
So you immediately, if they're at work, you want to isolate them, you want to send them home right away, but then you need to start thinking about setting up a procedure for contact tracing. You know, who did they come in contact with? The CDC has what's called contact tracing guidelines for just general businesses. They call it the 6-15-48 rule. 6 feet social distancing, no more than 15 minutes with said person, and 48 hours prior to coming in contact with that infected individual. Those are kind of the parameters. And if any of those things happen in the quote unquote perfect storm, then you want to self-quarantine anybody who came in contact with that person. So now that impacts your workforce again, because now you potentially have people out. So I think as you're working in a
Oh, no, I was just going to say, and I know that we saw some extended guidelines from, I think it was Larimer County, as to how you're supposed to be reporting that, what those look like, especially for specific industries that are related. So once again, things that you really need to do your due diligence to make sure what impacts you, what kind of organization you are, and to your point, how you're going to mitigate something like that should that happen in your organization.
Absolutely. I believe in your example, like a personal salon, like maybe massage or pedicure or nail places and things like that. Larimer County, for example, says if you have 2 people that test positive, you have to do X, Y, and Z. You have to follow this protocol. So the counties have even implemented specific guidelines. I think the other thing that you need to think about is now policies and documentation. Where are you going to start storing all this information? If you're taking people's temperature, where do you put that data? If you're taking in doctor's notes, you're taking in these FMLA paperwork or information, any of these kind of protected health information type items, you want to make sure you follow the state privacy laws. Colorado has the Data Privacy Act. Of course, you have other federal laws that protect that. Another thing you might want to think about is your workers' compensation insurance. As people get sick, are they going to file a workers' comp claim because it happened at work? There's a lot of discussion around whether some policies will or won't cover it, and there's potential claims. So these are things you may want to engage your insurance broker or whatever vendor you contract that information or that insurance through. And I think that in my opinion, maintaining a work environment that's designed with health safety in mind should be your primary focus. I think at the end of the day, if a business does that, putting the employee's safety at the top of their concern, they will set themselves up for the most success, i.e. protecting themselves from any future risk. I mean, it doesn't alleviate it or dissolve it or absolve them, but it positions themselves to mitigate the best risk.
I think you're right. And then, you know, and as HR in particular, you know, our focus is really to mitigate risk and establish culture. So while we're trying to make sure that our employees feel comfortable and safe coming to work, at the same point, we're also making sure that we've got those policies in place, documentation. There should be no question in the employee's mind how they're supposed to operate in this space in their new workplace, so that way it's clear as day and anyone would know it, for lots of reasons. First and foremost, the safety of the employee, and then followed by we're making sure that we're being communicative so that we can protect our organization as well. Good stuff. Anything to add? Moving along.
No.
One thing I know that we also saw is that there was some excellent guidance that came out from the state. I just had a note here. I want to make sure. I think it was yesterday, but it outlines a lot of this, as well as provides a checklist for employers to use. Super handy. You don't have to recreate anything. And so we'll provide that link along with a copy of what we're sending out after the presentation today. So let's talk for a moment about unemployment. And with the CARES Act, we made sure that people were supported during the time that they were unemployed. So there was also that additional $600 provided to employees for unemployment-related reasons, and that $600 would be extended through the end of June if needed. For the employer, if this was a COVID-19 related need for the benefit, X-mods were not set to increase and it wouldn't charge your account. So there was some really great relief there as well, so that way your employee was being supported and you were as well during that unemployment gap. Now, we found initially getting unemployment was challenging for people, and a huge increase really has occurred. But now we're working to bring people back to work, as we're talking about, and we have created a very high level process for how we see people working through bringing people back into the workforce. So as we found, getting people out of the workforce was certainly hard, especially emotionally speaking in many ways. But we're finding that bringing people back into the workforce is proving to be a little more challenging and difficult. So first, we see the need for employers to determine what it is that they need. We look at their financial circumstances and perform needs analysis modeling for where they are now, what they look like in 3 months, 1 month, 6 months from now, really something that takes us kind of through the end of the year. So one model, as my HR folks would be happy to know, is ADDIE. The ADDIE model stands for Analysis, Design, Develop, Implement, and Evaluate. So it's really an easy way to kind of see where we are at this moment in time and walk through a strategic process for how we return to work. Being strategic is really going to be important in order to bring your workforce back in a solid setup so that you're avoiding the seesaw method of hiring, laying off, hiring, laying off. We don't want to do that. So having some kind of strategic plan is going to be really, really advantageous for you to be working through. We talked a little bit about policies for return to work, which I know we talked about kind of in depth and in detail, Jeannie, in the last piece. So let's talk now about recalling employees, offer letters requirements. I know this is a passionate area for you. Why do you think it's important that we make sure that we provide offer letters to have people return from work?
Before I answer that,
yeah.
I just noticed in the chat, somebody said, should we be seeing the slides? Are we not seeing the slides? I can see it. I'm not sure if someone else can chat to me saying they can or can't see it. That would be great. I can see them. Perfect. Okay. I think we're good.
Okay.
Awesome. Thank you very much. I appreciate that, everyone. Awesome. Okay. Why do offer letters? You know, it's funny, and I thought about this. If you remember, you and I talked about this as we were knee deep into helping our clients lay off people, which was not. It was very hard. It was crazy times for all the folks on our team. But I remember about halfway through saying, "Hey, we got to start thinking about rehiring them." And you were like, "Rehiring? I mean, we're still laying them off." But we have to kind of, again, to your point, as HR people, look strategic beyond the moment. Yeah. And to your point, as we're laying them off, our goal is obviously to bring them back. And in doing so, it's not as simple as, "Hey, John, you want to come back to work?" or "Hey, Jane, thanks. Why not?" Well, the first thing is it may not be the same job. I mean, maybe when you laid them off and you've 2 months, 3 months have passed, your business has been cut in half, you decreased profits, your customers aren't the same, you maybe have lost a lot of business. There could be a whole bunch of variables, but the job that they left may not be the same job they came back to. The pay may not be the same. The title, and as we know, title is very important to folks. Exemption status, they may have been an exempt employee when they left, and the job you have them returning to may be a lesser position, and it may be non-exempt, and they need to understand, oh, I'm not going to be paid the same amount every week regardless. Now I only get paid for my actual hours worked. Or maybe the hours are different, or the location is different. I mean, there's a multitude of reasons of why they could be different. But by doing it and structuring it and saying, "Jane, you know, this is the job," you go through the whole offer. What happens if they say, "You know what, I don't want that job"? Mm-hmm. Great, okay. I'm sorry, you know, we will miss you, and they go on their merry way, and then they're going to file for unemployment. And then you're going to get a letter saying, "Hey, we're going to charge your account for this amount of money because so-and-so says they're unemployed." And you're going to say, "Wait a minute, nope, that is not the case. I offered them a job, and yet they chose not to take it. So no fault to yours. They have voluntarily resigned. You had a job to offer. They just didn't take it." And the state of Colorado kind of got very quick about this, and they actually created a form for employers to report this information, which is kind of unheard of if you think. I even think back to 2008 when there was a high unemployment. They still just, you know, ran their normal course, and 2 or 3 months later, you know, they would audit you. But now they're actually being proactive and saying, "Employer, tell us if people are being offered jobs and they have declined it." That way they can deny benefits. Yep. So that's a big one. I think, and then more importantly in all of that it's good documentation. It all comes back to you look beyond now, a year from now.
Mhm.
Your workforce is going to be different. The employment situation is going to be different, and you don't want to have to try to backtrack. Well, why does this person have a different title? Or you'll have maybe you have a new HR person, or things are just different. You want to have good records in place documenting your processes.
Totally agree. And I think that having that documentation is really important. So more importantly, setting expectations. But I think, excuse me, to your point, as we're talking about it, we're also going to see probably some absenteeism just in general, because people are going to be offered to come back to work. And I think that we're seeing people not come back to work in certain circumstances, maybe because they're concerned to come back, or they happen to be in a higher risk category or something like that. And so what we want to do is that offer letter kind of gives us that first initial conversation where maybe they're not refusing the position, they're nervous about coming back. And so we can start talking through that. And well, why are you nervous? Because we don't want to just assume it's because they just don't want to. I mean, we've heard that some people have said, I'm making more on unemployment, I don't want to come back. We've seen that. But we've also seen people really honestly just be very nervous about return to work. And most of the time we're able to kind of mitigate that and walk through it and make sure that we can find a solution that works for them. So be expecting some kind of interactive conversation, which is kind of our last piece here, and engaging in that interactive process. Jeannie, why is that so important?
I love the word interactive. It's actually the core of what a human resources professional has to do. If by us engaging in that interactive process and they say, you know what, we are scared, you're going to not only, again, be sharing the information and talking about why your work is you've already prepared for it, you're safe, you're doing all the cleaning protocols, you've taken all of that into consideration. But we should always be engaging in that process if you're at risk, now that invites them to share the opportunity to say, well, maybe I'm 8 months pregnant, because they've been out for the last 3 months, they hadn't shared it with you, and they're scared.
Yeah.
So now you can engage in that process and talk about, well, what kind of accommodations can we make? How can we help you? Mm-hmm. Maybe we set up an office where you have some exclusive, access or privacy or things like that. And then they're not as afraid, and you're being transparent in that process.
Agree. And I think there is a great tool that ADA actually put out, or the EEOC, surrounding that, a suggested kind of question survey that you could send out to employees. They don't have to necessarily respond and share a bunch of personal health information. They can just say, one of these situations applies to me. And that could give you some insight into, okay, we probably need to have further discussion around this. One thing I would encourage is that if this isn't an area that is really comfortable for you, really do engage with people, because there's a lot of things you can step in and not mean to if you're not really understanding how to ask the appropriate questions, not dive into too many personal areas that you don't need to know. And that can be something that can be really challenging right now, especially while people are feeling really vulnerable. So again, just something to kind of consider as you're working through that. Okay, so what I want to do is we're going to see if we can do this poll. So I want to just take a quick guess. So the poll that we're going to talk is remote back to work. So how are things going today? So I'm going to give us a couple of minutes here. Well, actually just a few, like 30 seconds or so. But the question is going to be, how is your workforce doing today? And you can check all that apply. Let's see if this will work. And so Jeannie, please do share with me if our poll has launched.
I see it.
Great. All right, we'll give it a couple of moments here. Please go ahead, check any that apply. And as we're going through, it's looking like we're seeing, we're doing some remote and some back at the office, is kind of a half and half mixture here. About 60% of our our respondents, and not at full capacity, running at full capacity, about 25%. And then we've got almost 20% of you out there needing some more workers. So I'm going to go ahead and end the polling and share the results here so you can see, and hopefully that will work. Great. Okay. So interesting, kind of all over the board. Encouraging though to see that we have some people working both, like in the office and not. Just super curious to see kind of how that would come about. So let's go and let's talk then about Colorado. Okay, so Colorado specific. Thank you for sharing your information. We appreciate that. It's always fun to kind of see where people are. We've covered our federal requirements, and we're going to jump into something a little closer to home. So in a review of Colorado laws, we'll be reviewing Colorado Health Emergency Leave with Pay Act, or Colorado HELP. We'll talk a little bit about safer at home requirements, and then how comps and equal pay for equal work are things that we should also be considering as we're working through our HR lives at the moment. So this was taken specifically from the FAQ, which was available online, and a link will be made available at the end of our presentation deck for your reference. But just some things to consider. So our safer at home requirements under the FAQ. So first and foremost is the governor won't hesitate to take necessary steps to protect the health and safety of Coloradans. And that includes going back to stay at home if we need to. So it's important right now, as we're doing the safer at home requirements, that we're trying to establish good working habits, both as individuals and as well as our guidelines for individual or specific industries. So one of the things that's noted in there, and I wanted to include, is that per the safer at home executive order, no vulnerable individuals can be compelled by their employer to return to work if their work requires in-person work near others, if the workplace is particularly unsafe. So if it had an outbreak, then unemployment benefits might be available. So again, something to consider, that this is again the guidance that's being shared with the regular population. And so certainly something to make sure that you're engaging in that interactive process for anyone who might feel that they're at risk. So again, cleaning guidelines available for the individual. We see it for daycares and schools. For restaurants are looking to start opening. And then of course, guidelines for hotels, hospitality. From the employer's perspective, some of the things that we've noticed are things around, making sure that we're establishing guidelines and guidance around healthy habits, what our environmental cleaning work schedule might look like. So even just sharing with employees what you're doing in the workplace, if you do hire a porter service, whatever that might look like, could be really helpful. And of course, then our social distancing requirements as far as face masks. And we've worked on some policies for our clients, really kind of focusing on what does that mean for this particular organization. So really, again, clear expectations and good communication is really going to make a difference here, we think. So let's talk a little bit about Colorado HELP. So the Colorado HELP rules, these are pay rules that are really designed to focus on these industries in particular. A few highlighted areas to note, as this could apply to almost all businesses out there. I mean, I think that we have offices and office work, and that in some of the businesses, like the elective medical dental health services, that may not be impacted by the federal or the FFCRA rules. So there might be some industries who are affected by the Colorado HELP laws, but not necessarily by the FFCRA. So for a little bit of description on what that might look like or what the pay rules require, the first is the pay to employees. So this would be paid at 2/3 of the employee's rate at up to 80 hours of pay, which is 2 weeks, but that's calendar days of days work. So if you normally work Monday through Friday, you would get paid for that Monday through Friday timeline. But if you started your leave June 1st, it would end June 14th. So again, it's calendar days on the normal days that you normally would work, or it would end at the result of a negative test for COVID-19. So if you had a prescription to go and get that test done and it turned out to be negative, you would be paid for the 3 days for taking the test and getting results back, and then afterwards you would go back to work. The pay rate is covered based on the established daily rate or an average of daily pay for the past month. So this is interesting because if you have an exempt level employee or someone who standardly earns a certain amount per day, that could be pretty easy. However, if you've got people whose rate fluctuates because it's based on hours that they work, or their commission or piece rate or something like that, then you would really need to go back and kind of establish that 30-day check-in to see what that pay might be on an average for the daily rates. So who is this applicable to? So this would be for somebody, employee who is isolated or quarantined by a healthcare provider, and documentation for this can be requested by the employer, and that would be something that would be in a written statement. Now, again, something being a little flexible here, you might see a standard template that's used, but it has a doctor's signature on it. That could be substantial for this, or substantiate that. And then from the provider, a prescription or a test or a written order, something that is demonstrating that you had to take the test or be isolated. Now, the employers in the industry, so something to be thinking about is that this is for the industries. There isn't a 500-person rule in this situation. So large employers could be impacted by the Colorado HELP rules, where they may not be under FFCRA. And again, that potentially healthcare workers or office environments, this could apply to them as well. So one of those things where maybe it didn't qualify at FFCRA could under the Colorado HELP rules. Now, if you've already provided leave, so if an employer provides leave or FFCRA does apply, then you don't have to use the Colorado HELP. So basically they say that whichever is more advantageous for the employee. So FFCRA is usually a little better for the employee. It's not 2/3 pay if it's for the employee's own health-related concern. And so for that reason, FFCRA may apply. But what if they've already done FFCRA and then something happens later on? Well, right now, at least as far as we understand right now, Colorado HELP is still in practice. And so there was a date, it was supposed to sunset, I think actually today, but I'd be surprised if they don't extend it. So just something to note that it might be canceled, but I don't think so. I think they were going to extend it. And then according to the Colorado HELP, again, we're federal or local sick leave law, or if let's say you as an organization offer 2 weeks of paid sick time or 3 weeks of PTO or whatever that might look like, if that's more generous, then again, you are able to provide that and you don't have to provide the Colorado HELP in addition, which is a little different than FFCRA, where it's not one or the other. Like you can pick and choose a little bit on the paid sick leave. This one, not so much if you do have it. However, if your employee has used 2 weeks and only has a week left of that leave, then you would still be responsible for the 2 weeks through the Colorado HELP. One through the sick leave policy that your employer might have, and then the second week with Colorado HELP. And then some other things to consider when you're looking at this, they do reference COMPS, which is the minimum wage order number 36. So certainly something that came out and was effective in March of this year. Things to be noting: break times, adjustment for exemption level, pay rates. Those types of things are something to be considered when you're looking at the pay rates on these. And then our just little reminder here is the equal pay for equal work. If you're not sure what this is, there's big changes for employers really coming as of January 1st. While you're kind of assessing all of these pay things, certainly something to kind of keep top of mind as we work through the end of the year. So this information is based on the region of Weld County, but for our purposes today, I thought I would share it because I thought it was helpful to share. Most Colorado businesses were not prepared for this pandemic, according to the results of this recent survey that was given out through Weld County Workforce. But they weren't prepared for the pandemic and expressed uncertainty surrounding future operations. I think that we can all understand that, and that's probably not shocking to a lot of people. But a majority of the businesses reported not being prepared for the changing economy due to COVID-19. Fewer than 1/3 of businesses across the state felt that they could stay open for more than 6 months with the partial shutdown of the economy. And about 40% of businesses anticipate that once social distancing measures are lifted, it would take at least 6 months or more for businesses to return to pre-COVID levels. So 2020 is going to be an interesting year. Let's just say that for sure. The impacts of COVID-19 on the business community has really been immense. About 1 in 3 businesses completing the survey were shut down at the time of the survey. So that's 33%. It's pretty significant. Declining sales was a concern for most businesses completing the survey, and more than 40% that remained open experienced reductions of 50% or more in sales. So this will certainly continue to impact Colorado's workforce. One of the biggest concerns is the business owners and operators are their employees, the ability to pay for them, and their safety. And then certainly revenue loss of the organization. So even though many businesses are trying to minimize layoffs, the severe shortage in revenue is causing many to pursue other options. There are options. You could do the work share program through unemployment. There are things that you could do. So just kind of keep that in mind as you're looking at having to navigate through this. So I think the one thing that we did learn is the information is critical. Thank you then to obviously resources like this to be able to let us do that, to do these types of sessions. So I want to go through one last poll quickly before we end out. So I'm going to go ahead and make this happen. I really just want to get a check on this call of where people are at, and we'll go from there. So let's go ahead and launch, and hopefully you're seeing that on your screen. So the question is, how are you feeling as far as preparation, planning, and execution, and the areas are going for your company? So the things we talked about today is strategic plan for workforce at least 6 months out, FFCRA understanding, CARES to understand, return to work policies, process, and safety, and Colorado help. So again, you should be able to check any of these here. And so far what we're seeing is that we have some people feeling very confident, awesome. A lot of people feeling that they're familiar but still working through things. Us too, I'll say that every day. And then feeling uncertain and maybe some uncertainty all around. I'll go ahead and share the results here just so that everyone can see. But that's good. Again, I think the need for information sharing is probably what is key on all of these. Okay, so as we end, what I do want to share is just saying, regardless of how you answer, just know we're working through this together. You're not alone. We cannot stress enough the concept of unprecedented times, and many people are not prepared, or we're not prepared for this, and we've seen in our polling that you're not alone, and we are here. So please reach out to partners like teams like HRX, like Elevate, like your payroll teams and partners and benefits partners. We're here and ready to help. So to review important highlights to be thinking about now: safety at work, non-discrimination, EEOC things, personal health information, and overall a flexibility and interactive process is really the keys. We want to say we appreciate your time. We know you have choices on webinars and information you can spend connecting on, so we thank you for your time with us today, and to support our communities in these efforts. You're welcome to connect with us at any time at hrxservices.com. I would again like to remind you we are recording this session. We'll send a copy of the recording along with the slides for your review and a survey asking about how we did. I also want to remind you that we're not attorneys or tax accountants, and none of what we have shared today should be perceived as such, and we will recommend always getting financial guidance from your partners in those areas. As always, I want to say thank you to Jeannie, my partner in crime in this. I could not have done this without you every time. Mike, I don't see you, but I want to say thank you for giving us this opportunity. As always, we will provide the link and handouts for anything that you need to review. We hope that you take care, and we look forward to talking to you again soon.
I will mention there is an eval in your inboxes that we would sure appreciate.
Awesome. Thank you. All right. Well, thank you all. We do appreciate you. Have a great rest of your day and take care.